Hi, I'm Reagan Kotsko. I'm one of the OBGYN doctors here with Virginia Beach Obstetrics and Gynecology, and today I'm going to talk to you about prenatal care and the services that we offer to take care of you during your pregnancy. The first thing that I like to tell any patient is that having a healthy pregnancy starts way before you ever get pregnant. Just in case you didn't know, you're supposed to be on a prenatal vitamin before you're pregnant so that you have enough folic acid in your system for a healthy baby really early before you even realize you're pregnant. There's also some medical conditions that it's a really good idea to have well controlled before you get pregnant. Diabetes, high blood pressure, the list goes on and on. If you take medications for any general medical conditions or if you have any medical complications, you can always come into our office for a preconception counseling visit and we can go over your issues, your medications. We can make recommendations about optimizing control of your conditions or changing medications that might not be the best medications to be on when you're pregnant. If you're having any difficulty getting pregnant, we also have some basic infertility services and we can help you with that, or we can refer you to a specialist if your needs are beyond what our basic services provide. But once you see those two scary little pink lines and you are pregnant, you can have your first prenatal visit with us, and we recommend that you do that nice and early so that if there are any conditions that haven't yet been addressed or optimized, we can do that really early in the course of your pregnancy. In our practice, we have 6 available board-certified OBGYN doctors, and we have a women's health nurse practitioner and a physician's assistant available. So when you come in, you can be reassured that your appointment's going to be with somebody with lots of experience and knowledge that's going to provide you the best care available.
Hi, I am Angela Simmons, the physician assistant. I am one of the participating providers of the obstetrical team here at Virginia Beach OBGYN, along with Lindsay Shreve, who is also our nurse practitioner. We will be here to provide convenient scheduling as well as your obstetrical care.
Your pregnancy interval visits may not seem like we're doing much, but actually we're collecting information about whether you're developing any complications of pregnancy, how your baby's growing, your health. Fortunately, the vast majority of pregnancies are very healthy and uncomplicated, but unfortunately, there are sometimes complications of pregnancy that can happen unpredictably, and that's when our obstetrical expertise is most important so that we can detect those issues and properly manage your pregnancy so that you and your baby have the best outcome possible. That's why it's really important to keep all of your regular scheduled prenatal visits from month to month, week to week, toward the end of pregnancy. Although it does not seem like we're doing much, the little bits of information that we do collect mean a whole lot to us, and it indicates how healthily your pregnancy is advancing. As the time of your delivery approaches, we understand that the labor and birthing process can harbor some fears of the unknown and some anxieties, and we will do our very best as that special day approaches to support you through those issues. We understand that that's a very natural response to the unknown, and we're familiar with that, and we're fine with answering your questions and spending time with you and getting you ready for your big day. And we look forward to nothing more than when it's time to welcome your little new life into the world, being there with you at the hospital, and it's a very special and privileged moment for you and for us, and we're very happy to be there with you at the end of it all and welcome your new healthy baby, and it really never gets old.
Hello, my name is Dr. Beverly Vavrica, and I'm one of the obstetric providers at Virginia Beach Obstetrics and Gynecology. Today I'd like to share with you a little bit about what you can expect as a patient of our practice in your labor and delivery and postpartum care experience. We are excited to be able to walk the journey of pregnancy with you and take joy in being a part of welcoming your little one into the world. We deliver at Centera Princess Anne Hospital. It is a brand new, beautiful facility with spacious labor and delivery suites and the same warm, caring nursing care that Virginia Beach has always boasted. We have in-house 24-hour anesthesia coverage, which avoids long wait times for epidurals. We also have a state-of-the-art neonatal intensive care unit that is considered a level 3 nursery. This allows us to continue your care closer to home should a complication with your pregnancy occur, such as preterm labor and delivery. We also have the beautiful mother-baby unit, again with the same warm, caring nurses and the same obstetricians seeing you during that time period as well. In the rare circumstance that a complication occurs that we are unable to care for you, then we also have a great working relationship with our maternal fetal medicine specialists at Eastern Virginia Medical School at Norfolk General Hospital. As a team of obstetric providers, we have designed our practice to be able to provide you with a fresh, well-rested provider during your labor and delivery management. What this does is it allows us to focus primarily on you while you're in the hospital, in so much that we do not have office responsibilities at the same time. We do a 24-hour rotating call schedule, and that being said, we are well rested and we take a no-rush approach to managing your labor and delivery. This allows you the optimal attempts at a successful vaginal delivery. What we have been able to do in this approach is minimize our primary cesarean section rates, in that we typically have a primary C-section rate that is lower than the national average. However, if the circumstance arises that you or your infant are in need of an operative vaginal delivery, we are ready and experienced to be able to perform both of those procedures. Following delivery, we continue to walk with you through this journey during your postpartum recovery period. During this time, we provide support for both physical healing, breastfeeding support, and screening for postpartum depression. We understand this is a time of immense change, and we are here with you to walk with you through it and support you in whatever ways possible.